we talk about baby being in a good position for birth, we, of course, want to see baby head down. Everyone knows that for sure. Breech deliveries are a lot more difficult if they even let you try. And so if baby's head down, we have a much better chance of having an easier, less complicated birth. So in addition to being head down, we also like to see that baby's back is facing mom's front, that baby's actually looking toward mom's spine. And the reason for this is that it's just easier to be born that way. I'll show you exactly how that plays out, but for now we'll just make sure that that's a visual in your mind. We've all heard of posterior labors or sunny side up births, and that's when the back of baby's head is toward mom's spine. That's what the reference is when we talk about posterior. So this is just a much more difficult way of being born. Labors generally take a lot longer, and they are much less comfortable. So we don't want you to have back labor, which is what this causes, and we want to avoid that and make things shorter. So we like to see baby facing mom's spine. That's called the anterior position. The next part about positioning that we really like to pay attention to is that baby will tend to, with some exception, prefer to be on mom's left side. The reason for this is that on our right side, we have our liver, which is a dense, hard organ. It doesn't have any give. It's like a little bit of a cement wall there. But on our left side, we have our stomach and our spleen, which are pretty squishy organs. So there's literally more room on the left side. So if I palpate a mom's belly and I'm seeing baby up on mom's right side, oftentimes mom will have rib pain. You get that? She'll be uncomfortable, it'll be more difficult to take breaths, any number of things that just tell us it's less comfortable for both of them. So if there are things that we can do, and there are a number of things that we can do to basically bring mom's pelvis back into balance, which allows baby to then choose the better position. They only get into a position because they don't have any other choices. So if we open up the choices for them and make sure things are balanced and open, they will always choose the more logical position, and they'll always wind up going to the left. Now in twin pregnancies, it's a little different story. Sometimes the placenta is on the left side, so that makes it a little harder. But in those situations, making sure that mom's pelvis is in balance will always make sure that during labor, as baby starts to descend, they are free to move into any position that they need to, so it will go more smoothly anyway. So as the baby gets bigger and gets ready to be born and they get larger and they start pushing down more, and you'll be noticing that over the next couple of months, having to pee a whole lot more. They get lower down and their head is pressing up against your cervix. Now what that does is when baby's ready to be born and baby's big enough, there's a certain threshold that's reached where the pressure on the cervix starts to create a little bit of a hormonal reaction in the body. So it sends messages to the brain to start creating that oxytocin. That is the hormone that starts to create those contractions to help labor begin and ultimately progress to be able to push that baby out. So as baby's head is on her cervix, the contractions begin. The contractions start squeezing around the baby, and there are a number of reflexes that are stimulated in the baby. The first one we'll talk about is called the stepping or placing reflex. And you can still see this in a newborn for several weeks after they're born. But if you were to take a newborn and put their feet up against a firm surface like a coffee table or kitchen table, you'll see them do this little stepping motion. It's a complete reflex. Yeah. The purpose of it, if you can imagine, as the uterus is contracting down, is to literally get the baby to sort of push off the top of the uterus to get themselves lower so that they can come on out. Now the nice thing about this reflex is that when you do this stepping motion, you can't help but have those hips wiggle back and forth. And so they literally are little wiggle worms even before they're born, and that's programmed into them. So you've got this pushing off the top of the uterus, you've got this wiggling of hips happening, and if you're in a tight bag of muscle, what's the best way to get out? Push off the top and start wiggling, right? So if you think about it, it's pretty amazing how mom and baby's body work together to make this process happen. It's literally a dance between the two. So the next reflex that I'd like to talk about is called the gallant reflex. This is one, again, that you would see on a newborn. If you stroke one side of their spine, they'll curve to that side. And if you stroke the other side, they'll curve to that side. Again, the benefit, more wiggling, now with the torso. So as they're descending, all of those reflexes are being stimulated. So they're pushing off the top, wiggling the hips, and then completely wiggling that torso as well. So as they get further and further down, and they're again coming down from that left side. The nice thing about this position, when baby is anterior, like we would like, is that the baby's face is actually cradled in the front of mom's sacrum. The front of mom's sacrum is a little cushy. There's some soft connective tissue and fluid there, and it actually guides the baby's face gently down the birth canal. If the baby is posterior and the back of the baby's head is up against mom's cervix, the back of the baby's head is very hard. So along with all that soft connective tissue, there are also sacral nerves. When there's a hard head pushing on sacral nerves, it's painful. So that's why a posterior labor is so much more difficult. So if we can, we try to make sure before labor begins that baby's in that anterior position. Because if baby is starting to come down and they're posterior, they also have to navigate underneath mom's pubic bone. A bit difficult here because the baby's chin has to tuck, and oftentimes babies who are born this way will have red marks here on their forehead, and that's literally the pressure on the pubic bone. And that will, pressure from the pubic bone, that will start to fade surely, but when they first come out, if you see a lot of red mark, it's a little bit of trauma from having to navigate under that pubic bone. Now, if they're coming down this way, and mom's sacrum is gently guiding the baby's face, you can see that the sacrum actually tips forward a little bit, that little coccyx bone. So what that does is it actually gently puts baby's head into extension, which we can all do pretty easily, much more easily than we could do this. And so what that does is just help the baby easily clear underneath mom's pubic bone, making that part just lickety-split. So at this point, we've got baby's head crowning. Baby's body is up here in mom, and that head is starting to arch and crown underneath that pubic bone. And if you'll notice, baby's head is over her left shoulder. What that does is it stimulates another reflex, which is really helpful. It's called the tonic neck reflex. And when a baby's head is turned over one shoulder, what they do is that arm and leg go out, and the other one comes in. Arm and leg on the other side comes in. So in the womb, it's not like they can stretch out. It's also called the fencing reflex. But what it does do, and you'll want to watch my shoulder blades here, as that reflex is stimulated, it narrows the diameter of the shoulders, which makes it easier for them to come through. It also makes it such that one is higher, and so only one at a time has to come out. Shoulder dystocia is when both shoulders are trying to come through at the same time. It's a little less ideal. Usually the attendant needs to try to get in there and push one shoulder back while pulling another shoulder through. But if everything is ideally positioned and this reflex is stimulated, the shoulder girdle is narrower and one is higher than the other. And so really with that next push, that first shoulder comes out, baby starts spiraling, and then the second shoulder comes out, and we catch. Simple, right? So you can kind of get an understanding now why position before you go into labor is just so very important, and how much easier it makes delivery. Certainly, if baby's less than ideally positioned, it can still happen. It's just longer, a little harder. What I'd like to do is make sure that it's not longer or harder for you. So all of these techniques that we will teach here today are to that end, to make sure that we're doing everything we can to support your structure, both bony structure, making sure pelvis is nicely aligned, and all the soft tissue. Most of what we'll be doing is the soft tissue structure. And there's a lot that dads can do to make this process that much easier.
So how often do we do this exercise?